Here I've listed common findings that I notice in people with low back pain. We have poor extension of the spine, often weak hip extension and weak hip abduction, imbalance in the hip flexors, not necessarily tight hip flexors. I want to say the word hip, imbalanced hip flexors, poor core strength, and I put poor in quotations because it's not as important as often taught. Limited overhead reach, meaning they have difficulty reaching with their hands overhead, and tenderness of the iliotibial band. Now, low back pain is such a broad, non-specific diagnosis, and one of the problems in trying to treat low back pain is we're trying to treat low back pain, the symptom, because there's a variety of reasons. There can be people with herniated discs with arthritis that has low back pain. There are people who have fractures with low back pain. There are people who have muscle imbalances that have low back pain. So now what winds up happening is that if somebody has a true anatomical problem, they have fracture of their spine because of a fall, or a herniated disc pushing on a nerve that actually causes pain shooting down the leg, well then probably these findings will be limited, and the pain inside the bone and the back itself, or the pain down the leg, will be the most prominent. But most people don't have a low back pain that needs surgery. Most people have a non-specific low back pain, and if the orthopedic surgeon has told somebody that this is a non-surgical issue, then most likely they have one or more of these findings. So people don't have to have all of these. They could just have 2 or 3 of them. But this has a significant impact on the overall mechanics of the spine. And so this is why it's common that people with low back pain who then have poor spinal mechanics, these are the common findings. So here are some principles of low back mechanics. One is that the gluteus maximus and the complex, and we'll talk about the gluteus maximus complex, which includes the gluteus maximus, the gluteus minimus, and medius. This little complex and the posterior chain, and we'll talk about that too, initiate almost all of our movements. That's an important concept. The psoas muscle, tightness, is sort of common and possibly important. So the psoas does play a role in the movement of the spine, but it also plays a role in the movements of the hips, but it's attached to the lumbars. And so therefore, sometimes psoas can have an indirect influence on it. But again, is it tightness or is it imbalance? That's what you have to consider. Core strength is not the issue. So we're going to talk about this too shortly, that core strength is highly overrated. And I'll explain what the role of core is and why it doesn't play such a singular prominent role in back pain, because nothing really plays a singular prominent role except maybe the gluteus maximus complex, and we'll talk about that. And then the deep interspinal muscles easily turn off with back pain. So those really small muscles that are attached from one vertebrae to the other, when they have back pain, those get turned off, they actually atrophy. And so those muscles play a critical role in spine-to-spine stability and spine-to-spine movement. So all of these principles, these 4 principles, collectively help create efficient or inefficient spinal mechanics. So here I have this picture. Imagine here's the head, here's the feet, and we want to raise the head up this way, we want to raise the feet up this way. Well, this is a picture of the gluteus maximus, and the gluteus maximus is bridging these two. Well, if the head wants to be lifted up, well, the gluteus maximus pulls downward, and by pulling down on one end, as long as it's strong enough, it will pull the head up the other way. Now, the other way, if you want to bring the feet up, well then you can pull down here and it will pull the feet up that way. Now that's not how the body really works, but what I want you to do first, imagine is, let's take away all the other muscles and just have the gluteus maximus. And the gluteus maximus, which is in the middle of our body, has this great influence. The gluteus maximus has connections up the spine and down the leg. So when it pulls on those muscles, then those muscles pull on other muscles, and they collectively work together. So this right here is what's considered the posterior chain. And it has influence all the way up to the head, and it's influence all the way down to the feet. So here I have a picture of the thoracic spine, lumbars, pelvis, trying to show a picture of the core. So you have your diaphragm at the top, transverse abdominis muscles, which actually attach here and wrap around and attach to the pelvis. You have your interspinalis muscles, these little X's that I represent, and the pelvic floor. These four muscles, these pair of muscles, collectively make up the core. And the diaphragm also has attachments down to the lumbars. Now, the core plays multiple roles at the same time. One, it helps with breathing. So when the diaphragm contracts, the pelvic floor contracts. When the diaphragm relaxes, pelvic floor relaxes, creating the breathing movements. Plus, your transverse abdominis muscle also plays a role in breathing. So the core plays a role in breathing. But it also plays a critical role in creating intra-abdominal pressure so that there is stability in the lumbars, because the lumbars have the solid pelvis here, the heavy chest wall here. So there's a lot of instability with this small little branch of spines. So these muscles around here create stability by bearing down. When you bear down and hold your breath slightly, it increases intra-abdominal pressure, which then creates stability here. Now these muscles have to work in a coordinated fashion. Imagine you're walking and you're carrying groceries. Well, if you're walking and carrying groceries, what's going on? When you're breathing at a regular pace, you are moving the top and bottom back and forth. So there's movement in the core horizontal, back and forth like this. And then you're also carrying a heavy weight, say several grocery bags. So then there's pressure bearing down on your spine. So then there has to be increased abdominal pressure. Well, all three of these things are essential core activities, but they're all a little bit separate. Breathing mechanics is separate from walking mechanics, which is separate than intra-abdominal mechanics. But they all have to work collectively together, so the brain has to coordinate it. But that's what the core is. So core is so much more than just the low back and for low back pain. It has this at least triad, this triple movement or triple functioning that needs to occur all the time. So here we have the side view of our spine. Here we have the diaphragm here. And we have here, the reason I have this empty space here is I want to show the glutes. So glutes play, remember what the glutes do, they help pull the feet back and pull the head back. Now we have the psoas, which comes from here and then comes down to here. Now where's that quadratus lumborum? Well, quadratus lumborum plays a critical role here. And then we have so the quadratus lumborum here. Then after that, we have this erector spinae muscle group that goes up through here. And with this erector spinae group, you now see the connection that I was making up here, how the gluteus maximus comes up this way and has interconnection here. Now this also goes down, and the gluteus maximus continues down with the, I'll go here, with the iliotibial band. So the iliotibial band goes this way. So the iliotibial band gets involved, which is what one of the mechanics, principal mechanics of low back. And then you also will have the continuation of the hamstrings down here. I'll just do this right down here, the hamstrings down there. So here's your kinetic chain all the way up. So this is how these interact. Now the front muscles, these flexor muscles up here, play a critical role in your front muscles, play an important role in moving you forward. Okay? We move forward because of these muscles. And the posterior chain helps us move backwards. So we have a balance situation. Now, the biggest challenge is gravity. Gravity pulls us downward, and we tend to then lean forward, which then allows the front muscles to be relatively tight, thus giving the illusion that the tight psoas muscles is critical. It's not an illusion, it's just not an absolute. If the psoas are tight, that's the problem. Because what happens is when the psoas gets tight and the front is generally tight because of gravity, prolonged sitting, the butt muscle gets elongated and gets weak. And then when the butt muscle gets weak, it helps to encourage more tightness here, and then you have this vicious cycle. And in the middle of all that, the quadratus lumborum and erector spinae muscles get involved too. So we have this, say, triple effect. Psoas, tight muscles, the QL gets tight, erector spinae muscle gets tight too, glutes get weak, and now we have a setup of low back pain. And unfortunately, the low back pain can be anywhere in this region. We then start to wake up the weak muscles, and we can start to loosen up the tight ones. Then this collection, this triple collection, begins to work in a coordinated fashion to help reduce low back pain.